This is a video demonstration to support techniques and procedures used in the book Korean Kinetic Acupuncture, Acupuncture's Next Generation Muscle Trigger Point Technique by Dr. Evan Mahoney. In no way should this be used by those without completed education, license, and degree in the curriculum of acupuncture and oriental medicine. Further training is recommended before one should begin practicing these techniques. The author takes no responsibility for mistakes or medical errors caused by those practicing these techniques. This video will not have needle insertion demonstration. For purposes of this book, these techniques should only be used for complaints of pain unless otherwise stated. It is to be understood that the practitioner using these techniques has a full understanding of acupuncture safety, contraindications, and proper needle location and insertion depth. This is Dr. Evan Mahoney's kinetic decompression stretch for the lower back, or the kinetic hanging back stretch. We're just going to do a demonstration. This is a demonstration video to support the book Korean Kinetic Acupuncture Technique. This is done after all the back procedures have been finished, and usually the last thing we do for our lower back patients to finish the treatment. I'm going to take this noodle, place it under the arms, double wrap, triple wrap. The more times you wrap around the bar here, the more secure, the more able you'll be able to hold the patient up, and it's easier to hold the patient up the more times you wrap at the top. So when the noodle's in place, you're going to instruct the patient to just bend their knees, and then they're going to walk their feet forward, and they're going to just bend their knees, let the weight of gravity pull and stretch the lower back. Their feet will always be touching the ground. Try not to have them swing or rock. So go ahead and walk forward, and then bend your knees, and just let the weight of gravity pull and stretch the back. The caution is the shoulders. Ensure that the patient comfort with the shoulders is always comfortable, and hold for 10 seconds. If everything's okay, ask, can they feel the back stretch? They should be able to feel the back stretch, and their shoulders should be comfortable. And then 10 seconds passes, stand up, and then have the patient walk in place, lift their legs up as high as they can, ask how does their back feel, and give it a minute or two or a few seconds, and then you're going to repeat the exercise. So let's repeat one more time. Bend your knees, come forward. Bend your knees, let the weight of gravity pull and stretch the back. The patient's not swinging or rocking, and they just let the weight of gravity pull and stretch the back. The shoulders should be comfortable. If not, then instruct them to stand up immediately. Stand up. You were able to feel the back stretch?
Yes.
Okay, good. And walk in place. And then that's how we finish our back treatment.